Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. It's your business to know what's going on out there in the technology front and the business front. And I love bringing in companies that, especially that I meet through things like LinkedIn. I always find it interesting, and often I'll see something there that resonates with me, and I want to share it with you. And today is just such an example. I got Mac McMillan with me, and he's with a company called Synergistech. And delighted to have you on.
Thank you, sir.
Yeah, my producer worked with me for about 10 minutes before you got here to make sure I got it right. So
well, he did it right the first time, so yeah. I'm impressed.
Yeah, we are. I am too. So tell us the story. Kind of give us the history, if you will, about your firm.
So the company, my partner and I, Dr. Mike Matthews, who's up in Dallas, we founded the firm back in 2003. We both came out of a similar background. Mike has more of a technical background than I do. I have more of a regulatory policy background. But I did 20 plus years in the government. Mike worked in the technical field. We both came together at a company when I first retired from the government that provided IT services to healthcare, and we both decided that what we needed, or what the industry needed, was a real focus on security. So we founded Synergistech in 2003, and I think we're the only company out there in the market that, or information security company, if you will, that exclusively serves the healthcare market.
Interesting. And there is very few markets that have more regulations, more requirements, more vulnerability and liability than that particular market.
You're absolutely correct. It is today the most regulated industry we have in America as it relates to privacy and security, and for good reason. I mean, there's a lot of very important information that those folks handle that's important to you and your producer and everyone else out there that goes to see their doctor or goes into a hospital and has things provided to them. Yeah.
Typically, how do you begin to engage with a client? How do you get your clients?
Well, we get a lot of our clients still today through referral, which is, in my opinion, still the best way to get one. Yeah. We do a lot through marketing. I do a lot of public speaking. I do a lot of educational work around the country. I speak at a lot of the conventions and that sort of thing. And we try to give back. I'm actually a volunteer leader for a group called HIMSS, which is the Healthcare Information Management Systems Society, which is basically that organization of all the IT folks in healthcare. And so basically we our philosophy is educate the user, right? I've always felt that companies, when they understand what they need to do and why it's important to do it, typically they'll do the right thing. Mm-hmm. As long as they can. I mean, there's always challenges to what we can do in business, especially small businesses versus large business. But for the most part, I'd rather work with somebody that's educated and understands the risk and is trying to build a program that's going to benefit their business than somebody who's just focused on regulation.
Mac McMillan, he's with Synergistech. And by the way, you can learn more about them, synergistech.com. That's Synergistek.com. So tell me a little bit about the profile, if you will, an overview, a panoramic overview of a client for your firm.
Sure. Well, actually, it's pretty broad in the sense that we have clients that are providers, hospitals, if you will, range anywhere from rural hospitals, very small acute care hospitals, all the way up to very large health systems with, multiple hospitals. We do work with some large physician groups. We do work with the payer community in terms of the insurance folks that work with healthcare. We do work with the clearinghouses, the folks that actually process the claims between the provider and the insurance company. And now we're actually beginning to do work with a lot of what we call business associates, those other businesses that work with healthcare who now have to meet the same requirements for privacy and security.
Got it. And so the company is a little over 10 years old?
A little over, yeah. We're in our 11th year.
Wow.
A decade
awesome.
Old.
Yeah, you're about to enter those teenage years, which means everyone's going to be hormonal and grumpy.
Yeah, and I'm beginning to realize that the more employees you have, the more you have to deal with.
There's a lot. It gets very interesting, very, very interesting. So, and that's an interesting panoramic or overview of what you do. Hospitals seem to be primarily in the rural areas, and larger medical groups are in the cities. Is that inaccurate?
Yes and no. You have a lot of very large hospital systems now that are beginning to expand through telemedicine and other.
That's, all of a sudden, that word, I hear it like every day now. It's like off the chart.
Yeah, I mean, you look at some of the examples, like what's going on in Arkansas with the University of Arkansas medical system, and places like Mississippi. Some of these states that have a very high density of rural healthcare organizations, like Texas, even. You're seeing a lot of the larger hospitals begin to develop these programs where they can get that expertise out to that smaller acute care hospital without actually having to physically be there, which is a huge benefit, right? Because if you're out in the middle of nowhere, as I call it, out in the middle of the country, God's country, if you will, right? Which we have a lot of in Texas.
Yes, we do.
You have only so many minutes if you have a stroke. Or if you're having a difficult pregnancy, for instance, delivery, you have so many minutes to get to a facility or in front of a specialist who can help you through that. Telemedicine brings that specialist right into that acute care facility, right? I mean, there's phenomenal things that healthcare does today, and that with the technology that we have that allows a doctor sitting in Little Rock to literally be in northwest Arkansas, through a video screen, looking at the patient, talking to the physician that's on site, and helping them to make the right decisions. I mean, it's just amazing what they can do.
Are you growing pretty robust growth?
We are. We last year, we had a phenomenal year. We actually grew almost 300% in terms of revenue, and we doubled the size of the company. A lot of that's due to
that doesn't suck, as they say.
No, it's a nice place to be, and despite the comment I made earlier, we are at a place right now where actually coming to work is a lot of fun, because I have a really great crew. I have good leaders that are in charge of the different groups that we have, because we have a group that focuses in privacy and security, a group that focuses on the technical side of it, and a group that focuses on the audit side of it. And we've just got super people that are working for us.
Mac McMillan, he's been our guest, Synergist Tech, and that's synergisttech.com, CYNERGISTEK.com. Thanks so much.
Thank you, sir.
Great topic. Enjoyed it. When we come back, much more for you. Do want to remind you, best content here, it shows up over there at usdailyreview.com. While there, make sure you like it on Facebook, follow it on Twitter.